extremely important in terms of trying to identify a mechanistic approach in an animal model, especially a murine model. Thanks very much for getting me the manuscript. I just have three simple questions. What do you think is the clinical model of pancreatitis that the sodium taurocholate mimics the most? And does it matter if it mimics one model more versus the other? Is it just biliary pancreatitis, or do you think that you can reproduce this with other mechanisms of pancreatitis? You didn't mention much in your talk, but in the paper you talked about obese mice. And what were you guys hoping to find with the obese mice in terms of hypothesizing before you started? I know most of those mice died. And then I guess the final question is, what's the next step? This model is, it looks like it's been validated and could be a good clinical model, but in mice, therapeutically and stuff, what are you guys planning on doing else? Thank you very much for allowing me to discuss the paper.
Thank you very much, Dr. Shah. As far as the first question, certainly this mimics biliary pancreatitis in that sodium taurocholate is a bile salt, and the presence of bile salt in the pancreatic duct, as you know, leads to inflammation and ensuing inflammatory reaction. Probably there may be some component of obstructive pancreatitis here too, that this may mimic some of the things that happen with obstructive pancreatitis. You know, the sodium taurocholate is infused with a pump into the duct, which is, you know, obstructed at least for some amount of time, but it's certainly not a significant length of time that the duct is obstructed. I can't speak to whether it would mimic any mechanisms involved with, for example, alcoholic pancreatitis, but certainly this is, certainly biliary pancreatitis is a relevant and major cause of a lot of disease in our patients. In the obese mice, we did study a few obese mice, which will be in the manuscript, but not enough of them survived to really statistically analyze a lot of the data. Our goal with the obese mice has to do with some of our general laboratory goals. We've been studying the impact of obesity on both pancreatic cancer and pancreatitis, and we have an obese mouse, several obese mouse models that we've used. And in other models of pancreatitis, for example, the cerulean stimulation model, we found that the obese mice had a much more severe pancreatitis. So our hope, again, was to see what effect obesity had on these mice who had sodium taurocholate-induced pancreatitis. And our next step will actually be to sort of increase the numbers of mice and again have an arm of obese mice, also an arm of mice who are not genetically obese but have dietary-induced obesity, to see what the effect of diet has on severity of pancreatitis in comparison to the lean mice. So we're very excited about continuing the use of this model.
I have one quick question. Very nice model. The animals that died, did they die of pancreatitis? Did they have a worse pancreatitis? And also, is there any areas of necrosis, or is this mostly just mostly an edematous pancreatitis?
Thank you. Those are actually great questions. The